talk about, in terms of what we're doing and looking at the levator ani muscle injuries, that this is not some sort of esoteric, research work, that what the body of evidence shows about this association between obstetrical injuries at the levator ani attachments,
Mm-hmm.
general hiatus area, development of pelvic organ prolapse. Walk us through that so that, this is not some random study that we've seen in some bizarre journal. This is real.
Yeah. I mean, all the words you used are incredibly important and what we use all day, every day. So I'm going to try to break it down, but in a way that simplifies it somewhat, right? When we think about the vagina and we think about the opening, we call that the general hiatus, right? And if you can imagine someone about to deliver, right? The baby's in the canal and it's coming through the fetal canal. We're getting close and close to the entrance of the vagina. What happens for us is this, right? We're having stretching of the general hiatus of the entrance of the vagina becoming larger and larger and larger. As that occurs, we're thinking about that superficially, but a urogyne is also thinking about that a little bit more deeper, right? We're thinking about the muscles back here on the sides, deeper within the pelvis. And so now those are the levator muscles that are holding the pelvic floor. And that's the strength that holds everything up within a woman. Now we're getting the stretch, but the stretch could be very gentle. Hopefully, it could be very methodical, it could be very slow. But for many women, that's not the case, right? Once we have full dilation and then the baby's coming out, now we're getting descent. And descent happens at a very different timeline for many women. And for those women especially who have very, quick descensus, we're not getting this careful stretching of those muscles of the levators here. Now we're getting a rapid burst. That rapid burst can cause tearing or avulsion of what we call the levators.
Mm-hmm.
So now, if this is the vagina and we have all these muscles holding everything up in a very strong, methodical way, now we have a tear, whether it be one side or the other side or both sides. This tear can now cause these structures within the vagina to fall, whether it be bladder, rectum, cervix, or uterus. And that fall is prolapse, right? And half of these women will now have symptomatic prolapse, right? That have that fall occur. They'll feel it, they're going to pick something up, and they're going to feel a bulge coming downward. And so that's why none of this is esoteric, right? That's why when we think about the levators, we're thinking about the support structure of the vaginal canal. And when we think about that being torn or having an avulsion, then something must happen as a byproduct of that. Whether someone's symptomatic or not is based on that patient. But when they are, then they come to me and then we talk about treatment strategies.
What are your thoughts?
I think, I've been thinking actually pretty deep about this because there is a movement of some, practitioners as well as patients saying, hey, I never was told this, right? These are these things that are happening to me after the delivery where it's leakage or prolapse or pain. And, I don't remember getting this information before. And I think, as providers, every decade of that we've been practicing, we're adding something else to the mix.